The difference between living to 60 versus 90 often comes down to the signals that your body is broadcasting right now. Signals most people, understandably, never think to check. Over the past decade, I've become quite obsessed with this question. What separates the 90-year-olds who walk into A&E independently from those in their 50s who can barely manage? What distinguishes the 75-year-old still hiking mountains from one who struggles with the stairs? Well, the answer often isn't luck, and it's rarely genetics. It's measurable. It shows up in blood tests, in how quickly your heart recovers after exertion, in odd things like whether you can sit on the floor and stand back up without using your hands. Today we're covering 9 longevity signals, and what unites them is that they all reveal something fundamental about your body's reserve. Its capacity to handle stress, repair damage, and maintain function under pressure. So let's dive into it. At number 9, we have kidney filtration rate. Your kidneys are running a stress test on your vascular system every single minute, and most people have no idea that this is even happening. The estimated glomerular filtration rate, or eGFR, which we check every single day in the A&E, and most of you have probably had this checked by your doctor. This test measures how efficiently your kidneys filter waste from your blood. And you might think that this only matters if you're heading towards kidney disease, but that's missing the deeper truth. Your kidneys contain an incredibly dense network of tiny blood vessels, and when those vessels start showing damage, it's almost never isolated to the kidneys alone. Think of eGFR as reflecting the cumulative burden of vascular damage, of inflammation and metabolic strain that your body has absorbed over years or decades. It's essentially a barometer for your entire vascular system's health. The research here is remarkably consistent. The CKD Prognosis Consortium pooled data from multiple countries, and they found a clear relationship. As eGFR declines, risk increases. And we're not just talking about kidney disease risk here, we're talking about cardiovascular events, heart attacks, strokes, death from any cause. What's striking is that this pattern holds true even in ranges that we don't label as kidney disease. Someone with an eGFR of 70, where normal is above 90 odd, might never develop kidney disease on paper, but their mortality risk is measurably higher than someone with an eGFR of 90 or 100. And that tells you something important. While blood pressure tells you about the pressure in that moment, or cholesterol tells you about just one risk factor, eGFR integrates years of exposure. It shows how your blood vessels have held up under chronic stress from blood pressure fluctuations, from blood sugar variations, and inflammatory insults over years and years. If you're getting any routine blood tests done, then GFR is usually included in that. At number 8, we have coronary artery calcium scoring, or CAC. Now, there's a fundamental difference between knowing your risk factors and knowing whether disease has already started in your arteries. And coronary artery calcium scoring bridges that gap. The CAC score uses a CT scan to measure calcified plaque in your coronary arteries. And here's how I tend to frame this. Cholesterol is like the fuel, but CAC is the evidence of fire damage in your arteries. You can have high LDL cholesterol for years without symptoms, but during that time, atherosclerosis is quietly progressing. LDL particles infiltrating the arterial wall, triggering inflammation, forming plaques. Over time, some of these plaques calcify, and that calcium becomes visible on a CT scan, giving you objective evidence that disease has developed, even if you feel completely fine. The research validating CAC scoring is robust, and it predicts heart attacks. It predicts the need for procedures, and it predicts cardiac death, often outperforming traditional risk calculators. Two people might have identical conventional risk scores, but if one has a CAC score of 0 and the other has 400, their actual risk diverges dramatically. This is where CAC becomes most useful for people in that middle zone of risk. If you're clearly high risk or clearly low risk, CAC probably won't change your management, but if you're middle-aged with borderline cholesterol and uncertain about starting medication, a coronary artery calcium score can shift that decision substantially. And it's probably useful at this point to talk about apolipoprotein B or ApoB because there's often a lot of confusion here. ApoB measures the number of atherogenic particles in your blood right now, your current threat level, while CAC measures the consequence of past atherogenic burden, the historical damage already done. And here's the critical point that trips people up. If you're young with elevated ApoB, you might have a CAC score of 0 because plaque formation takes years to calcify. Early plaques are soft and invisible on a standard calcium scan, so you could have significant plaque burden with a perfect calcium score of 0. More importantly, a 0 score doesn't tell you about future risk if you're continuing with elevated ApoB. If you're 35 with an ApoB of 150 and your CAC score is 0 today, that doesn't mean that you're safe. It means that you haven't accumulated enough plaque yet for it to show up. But if you do nothing for the next 20 years, by your 50s or 60s, your CAC score will be high and the damage will be done. My view is that CAC scoring and ApoB measurement are complementary. They're not substitutes. So use them together to get the full picture. At number 7, we have heart rate recovery after exercise. So fitness isn't just about how fast you can run. It's also about how efficiently your body returns to baseline once the stress ends. And heart rate recovery, specifically how much your heart rate drops in the first minute or two after stopping exercise, provides a window into your autonomic nervous system function that's remarkably predictive of long-term health. The concept of this is quite interesting. So during exercise, your sympathetic nervous system ramps up to meet your muscles' oxygen demands. But when you stop exercising, your parasympathetic nervous system should then kick in quickly to bring your heart rate back down to normal. The speed of this recovery reflects the balance and function of your autonomic nervous system. Good vagal tone means that your heart rate drops quickly. Poor vagal tone means that it stays elevated for longer. Now, the landmark research from Cole and colleagues found that abnormal heart rate recovery, defined as a drop of less than 12 beats per minute at 1 minute after peak exercise, was a powerful predictor of mortality. And this held true even after adjusting for standard risk factors and exercise capacity. What makes this marker so valuable is that it integrates multiple dimensions of health simultaneously. It reflects cardiovascular fitness because people who exercise regularly tend to have better recovery. It reflects autonomic balance because chronic stress and poor sleep reduce parasympathetic activity and slow recovery. And it may reflect underlying cardiovascular disease, since people with coronary artery disease tend to have impaired autonomic function even before symptoms appear. You can actually measure this yourself, and that's part of what makes it so practical. Do a bout of exercise, either a brisk walk uphill or hard cycling, running intervals, or just squatting continuously. Then stop abruptly and check your heart rate at 1 minute. If your heart rate has dropped by less than 12 beats a minute after stopping exercise, then it's worth addressing. So how do you actually improve this? Well, there's 2 parts to this, which is zone 2 training and interval training. Now, zone 2 aerobic training builds your cardiovascular efficiency. This is exercise where you could hold a conversation, but it's somewhat challenging. And intervals train your body's ability to shift gears between high and low intensity. Sleep consistency is also crucial here because poor sleep blunts parasympathetic activity, and you can see this in your own data. After a terrible night's sleep, your recovery absolutely will be measurably worse. Stress management has concrete effects on autonomic balance because chronic stress keeps your sympathetic nervous system activated. And overtraining deserves a special mention here because athletes very often chase harder and harder workouts thinking that more is always better. But overtraining typically manifests with impaired heart rate recovery as your body tells you it's not recovering adequately. At number 6, we have the sitting and rising test, which is a functional test so simple it seems almost trivial, but it predicts mortality with surprising accuracy. This isn't a party trick, it's a snapshot of multiple physiological symptoms that degrade with aging, which are strength, balance, flexibility, neuromuscular coordination, and body composition all wrapped into one movement pattern. The test was actually popularized in Brazil, and the research examined middle-aged and older adults over several years, scoring their ability to sit and stand without using their hands, knees, forearms, or the side of the leg for support. The findings were quite striking. A clear, graded relationship between score and mortality risk, where people who scored lowest had significantly higher mortality compared to those who scored highest. Think about what this movement actually requires, and you'll understand why it's so predictive. You need lower body strength to control the way down and power to control the way up. You need core stability to maintain balance throughout the movement. You need hip mobility and flexibility to achieve the positions without compensating. You need ankle mobility and calf strength for the push-off when standing. You need upper body control for balance, even if you're not using your hands for support. And you need neuromuscular coordination to sequence everything smoothly. When someone can't perform this movement, it usually signals deficits across multiple areas. Maybe they lack leg strength, maybe their hips are stiff, maybe their balance is poor, and often it's just a combination of those. These deficits predict future problems beyond just difficulty getting off the floor because they predict falls risk, they predict functional decline and frailty, which correlates with worse outcomes across virtually every health domain. So what do you do with this? Well, the first thing to do is to try the test yourself and see if you're able to do it safely. Sit down on the floor and stand back up without using your arms, minimizing support as much as possible. And be honest about your score. If you performed it easily, then that's excellent. You've maintained functional capacity in these domains. If you've struggled or couldn't complete it, well, you've identified areas needing work. And that's actionable information, not cause for despair. Training these components is fairly straightforward. Squats or other leg work builds leg strength. Hip mobility work addresses stiffness through stretches and movement patterns. Single leg balance training improves stability, and then practicing the actual movement regularly with whatever support you need and then gradually reducing that support trains the pattern itself. The broader principle here is that functional capacity, which is the ability to perform real-world movements that matter for independence, is trainable and worth prioritizing because it directly impacts quality of life as you age. At number 5, we have heart rate variability. So your heart doesn't just beat like a metronome, and that's a good thing. Beat-to-beat variation in the intervals between heartbeats, what we call heart rate variability or HRV, provides a window into your autonomic nervous system's balance and your body's capacity to handle stress and recover. Higher variability generally indicates better autonomic function and resilience, while lower variability associates with chronic stress, inflammation, poor metabolic health, and cardiovascular disease. The physiology here centers on competing influences of your sympathetic and parasympathetic systems. Your sympathetic system increases heart rate and reduces variability when you're stressed or exercising, while your parasympathetic system, particularly vagal tone, slows heart rate and increases variability when you're relaxed or sleeping. The value as a longevity marker comes from what it reveals about chronic stress load and physiological resilience. Research shows that lower HRV is associated with increased cardiovascular risk, with worse metabolic health, and increased mortality across the board. And it makes sense if you think about it, because if your autonomic nervous system is chronically shifted towards sympathetic dominance, You're in sustained physiological stress that drives inflammation, which impairs recovery and accelerates vascular aging. The key to using HRV effectively is understanding that it's a trend marker, not a daily scorecard. HRV fluctuates based on your sleep quality, on recent exercise, on alcohol, stress, illness, and many other factors. So a single low reading doesn't mean much. What matters is the pattern over weeks and months. Many people become anxious about the number, checking it obsessively and worrying about every dip. And this defeats the whole purpose because HRV gives feedback about your overall stress recovery balance, not another source of stress. The easiest way to use HRV is to keep it simple. You don't need any special tests, just wearing a smartwatch or a sports watch does the job. I use my Garmin sports watch, which measures my HRV quietly in the background while I sleep, so I don't even need to think about it. The key isn't the exact number on any single day. What matters are the patterns over time. If your HRV is trending down, that's usually your body telling you it's under more stress or not recovering well. If it's trending up, then you're probably doing something right. If you want to improve your HRV, then start with the basics. Sleep comes first, absolutely, because we know that poor sleep wrecks your nervous system. And HRV is often one of the first things to drop when your sleep is off. A consistent bedtime and good quality sleep makes a huge difference here. Regular aerobic exercise also helps. Building a decent cardio base, things like walking, cycling, or steady state hiking, makes your heart and nervous system more efficient over time. And HRV tends to rise as a result. Alcohol is another big one. Even small or moderate amounts can suppress your HRV for days, especially if you drink in the evening. And many people are genuinely surprised how clearly this shows up in their data. Stress matters as well. We know that practices that help your body switch into a calmer recovery mode, like slow breathing, like meditation, or simply taking proper breaks, this usually improves your HRV over time. The important thing to understand is this. The goal isn't to chase a higher HRV number necessarily. HRV is just feedback. When you build a lifestyle that supports good sleep, sensible exercise, low chronic stress, and proper recovery, HRV moves on its own. When it does, that's simply confirmation that your body is coping well and becoming more resilient. At number 4, we have waist measurements. And the reason this matters is that BMI on its own often misses the most important part of the picture. Your waist circumference tells you where your fat is being stored. And fat around the middle, especially deep abdominal fat, is far more closely linked to heart disease, type 2 diabetes, fatty liver disease, and poor metabolic health than your body weight alone. Fat just under the skin is mostly just storage, but fat inside the abdomen behaves very differently. It releases inflammatory chemicals, it interferes with how your body responds to insulin, and it sends excess fat to the liver. And it's associated with higher triglycerides, with lower good HDL cholesterol, and more of the harmful cholesterol particles. Large studies show that waist circumference predicts health risk and even early death, even after accounting for BMI. Which means that two people with the same weight and the same height can have very different risk profiles depending on their waist size. A simple rule that works well for almost everyone is waist to height ratio. Your waist should be less than half your height. So if you're 170 centimeters tall, your waist should be under around 85 centimeters. And if you're 6 feet tall, it should be roughly under 91 centimeters. At number 3, we have hearing loss and brain health. And this is one of those links that surprises people, but is actually very well supported in the research. Even mild hearing loss, the kind that many people brush off as just getting older, is linked to faster cognitive decline, a higher risk of dementia, and reduced social engagement over time. And what makes this especially important is that it's something we can do something about very easily. When hearing isn't clear, your brain has to work much harder just to understand speech, which means fewer mental resources are left for things like memory, attention, and thinking clearly. And over years, that extra effort adds up. On top of that, parts of the brain involved in hearing can actually shrink when they're understimulated. And studies show that people with hearing loss often have reduced brain volume in areas not linked just to sound, but also language and memory. Then there's the social side to this as well. When hearing becomes difficult, especially in busy environments, people often start avoiding conversations, they avoid restaurants or group settings because it's tiring or frustrating. And that social withdrawal itself is a strong risk factor for cognitive decline, creating this double hit to your brain health. One of the strongest pieces of evidence comes from a large study called the ACHIEVE trial, which showed that older adults who received proper hearing care, including hearing aids and support, had a slower rate of cognitive decline compared to those who didn't, particularly in higher risk groups. It didn't stop the aging altogether, but it clearly slowed the process, which is exactly what we care about with long-term brain health. The takeaway here is practical. Get your hearing checked earlier rather than later. Don't delay using hearing aids if they're recommended, and actually wear them consistently, because sensory health isn't just about hearing better day to day. It plays a real role in protecting your brain, keeping you socially connected, and preserving cognitive function as you age. Moving on to number 2, we have your reaction time, which is essentially how quickly your brain takes in information and tells your body what to do. And it turns out to be a surprisingly powerful marker of overall brain health. Reaction time reflects how well multiple systems are working together. Your attention, thinking speed, your coordination, your senses like vision and hearing, and the health of your blood vessels supplying the brain. And large studies show that slower reaction times are linked to higher risk of illness and even earlier death, even when you account for other factors. Reaction time itself isn't actually causing these outcomes. It's acting like a dashboard warning light, because when processing speed slows down, it often reflects deeper issues like early vascular disease, poor metabolic health like insulin resistance, chronic inflammation, sensory problems, or declining motor function. Data from huge population studies show that people with faster reaction times tend to have healthier brains and healthier bodies overall, while slower reactions suggest something in that chain that isn't working as well as it should. The good news is that reaction time improves when you look after the fundamentals. Good sleep is critical, because even mild sleep deprivation can slow reaction time to levels similar to being drunk. Aerobic fitness supports faster thinking by improving blood flow to the brain. Stable blood sugar and good metabolic health protect cognitive processing speed. Clear vision and clear hearing matter enormously as well, because your brain can only react to what it receives accurately. And maintaining strength and coordination keeps the physical response side of things sharp. The goal isn't to practice reaction time tests or chase a number, it's to build a lifestyle that supports brain, metabolic, and cardiovascular health. And when you do that well, faster reaction time is simply one of the signs that you're on the right track. And finally, at number 1, we have arterial stiffness, which is one of the strongest but least talked about predictors of long-term cardiovascular health and longevity. And most people will never have this formally measured. So blood pressure tells you what's happening inside your arteries at a single moment, but arterial stiffness tells you what's been happening to them over years and decades. Healthy arteries are elastic. They expand with each heartbeat and gently release that pressure between beats, which protects the delicate blood vessels in the brain and the kidneys and the heart at the end of those vessels. But as arteries stiffen, that cushioning effect is lost. Pressure waves travel faster through the body, pulse pressure widens, and small vessels are exposed to damaging pressure swings that gradually cause organ damage. You might not feel this happening because arterial stiffness develops silently over years, but there are some clues. a widening gap between the top and bottom blood pressure numbers, dizziness when standing up, stronger pulsing sensations, or blood pressure that becomes more variable over time. These are all big clues. Large studies show that stiffer arteries strongly predict heart attacks, strokes, heart failure, and cardiovascular death, even when blood pressure looks acceptable, which is why this matters so much. The good news is that the same things that protect overall health also protect your arteries. And that includes controlling your blood pressure consistently, building aerobic fitness through regular steady exercise, improving metabolic health and blood sugar control, sleeping properly, especially treating sleep apnea if you've got this, managing chronic stress, and eating a diet based around whole foods rather than ultra-processed foods. Poor sleep, insulin resistance, inflammation, and inactivity all slowly harden your arteries over time, while movement, good sleep, and metabolic stability help to keep them flexible. Arterial stiffness is really the physical record of how your body has been treated over a lifetime. So even if you never measure it directly, watching your blood pressure patterns and addressing these underlying drivers is one of the most powerful things that you can do to protect your brain, your heart, and your long-term health. When you zoom out and put all of these together, these 9 markers are really about reserve. They don't just tell you whether you have a diagnosed disease today, they tell you how much capacity your body still has and how well it can cope with the stresses that build up over a lifetime. You don't need all 9 to be perfect, and you don't need to track everything at once. What matters is choosing a few that are most relevant to you and improving the trends over time. Pick one blood marker like kidney function, one vascular marker like ApoB or simply watching your pulse pressure, one recovery marker like HRV or heart rate recovery, one functional test like how easily you can get up off the floor, one body composition marker like waist circumference, and don't forget sensory health by getting your hearing checked. The encouraging part is that all of these improve through the same core behaviours. Good sleep improves recovery, reaction time, metabolic health, blood pressure, kidney function, and arterial health all at once. Regular aerobic exercise improves cardiovascular fitness, brain health, insulin sensitivity, arterial flexibility, and body composition altogether. And good nutrition reduces inflammation, it supports metabolism, it protects blood vessels, and it fuels your brain health. The real value of tracking these markers isn't chasing perfect numbers. It's having honest feedback about whether your lifestyle is actually working. If your HRV is falling despite thinking that you're managing stress well, sleep is probably the issue. And if your waist size is creeping up despite eating healthy, then something about portions, about timing, or food quality probably needs adjusting. These aren't one-off tests that you do and forget about. They're signals that you follow over months and years to see whether you're maintaining function or declining faster than normal aging would predict. And the most important thing to understand is that none of these markers are fixed. Kidney function can stabilize, arteries can become more flexible, fitness and recovery can improve dramatically, waist size can come down, and functional capacity can be rebuilt. Poor results don't mean failure. They mean you've been given information that you can act on. You're not helpless in the face of aging. You have power. Measure something, make one change, track what happens, adjust based on the feedback, and then build from there. That's how you create not just a longer life, but a better one. By paying attention to the markers that actually predict longevity and consistently doing the things that move them in the right direction.